For many years, I was an elite international gymnast, but ultimately I had to retire earlier than I expected due to heavy periods, debilitating cramps, and backache around my time of the month. But now, nearly 10 years on, I'll be speaking to athletes from different sporting backgrounds and medical professionals to see how athletes cope and what is being done to help them. Menstruation affects athletes and their performance, but recent research has shown that athletes can adapt their training around their cycle to optimise their performance. Tatiana is part of the England women's rugby team and Gloucester Heartbreak, and told me about her experience.
We don't do much of it at Gloucester, but when we've been in and around England camp, there has been discussions on different areas of your cycle and when you're at your best and when you're maybe not as strong. But the thing I like to think about is obviously there's times when you're not going to feel as good, but then when you're feeling great, that's the time to really push on. So I think that's where I tend to use it to my advantage. I think knowing your body and knowing when you're going to feel good is the best time. Well, that's what I find is the best for me to be able to push on and make gains in the gym and on the pitch and stuff.
70% of women and young girls avoid sports and exercise when on their periods due to pain, fear of leaking, tiredness, and self-consciousness. Tatiana gave me her opinion on how she thinks period anxiety around sports can be reduced.
I think it's really important to make sure people are aware of each stage and that you're not always going to feel great, but also you're not going to feel great when other people do, or when other people are feeling at their worst. You might be feeling really good, so just making sure that everything you do is on an individual level. I think there needs to be a lot more awareness around that. I think when it comes to grassroots, I think in terms of women and girls participating and getting more people involved, I think just making it more, I don't want to say acceptable, but normalised talking about periods and things like that, because I guess people probably do feel uncomfortable. I know when growing up I played with the boys and I didn't even ever really think about things like that then, but I guess now probably young girls that do play with the boys, maybe they're worried about things like that. Maybe that's why they don't want to carry on playing, or maybe that's why you need to have more girls teams so that people feel more welcome and feel like that they can be themselves and express how they feel about being on their period or not have started their period yet or anything along those lines. I think it needs to be really normal for people to be able to feel comfortable talking about it. But I think in an elite environment, you do just have to, we are women and we are going to have a period, so you have to be able to manage that and find the best way for you, because otherwise we're not going to be performing at our best, and ultimately that's what we're here for.
In recent years, there's been a shift in women's clothing in sports to help reduce period anxiety, with the changing of short colours from white to dark colours. However, England Red Roses Tatiana explains as to why they have decided to stick with the white shorts.
In the end, I think we voted and the majority said that they wanted to carry on wearing the white shorts, and I think it is just people should feel comfortable, because it shouldn't be taboo. So I think it's okay that we wear white shorts, and it's okay if you leak onto those shorts, you can just change them, things can be done. It's not the end of the world, and I think the world as a whole and the rugby world should be okay with that.
Women are 6 times more likely to suffer an ACL injury compared to men, but as of right now there has been little scientific research as to why women are more susceptible to the injury. There are theories that suggest menstrual cycles play a key role, however there has not been enough evidence to support it yet. Tatiana has suffered 3 ACL injuries during her career, some of which have coincided with her period, but could they have been prevented?
I think it's hard to say, because obviously it's a really they are common injuries, and there's a lot of factors that come into that, because now I could say, if touch wood if I got an injury, I don't think it would be because of my period, because I know how to manage and manage my nutrition around that and my activation and all that kind of stuff, but also there's a lot of other things that I manage in terms of injury prevention, so it's hard to say that it would have just been the period or not, because I guess there could have been a lot of other factors, like I was young, I maybe hadn't done the proper warm-up, I hadn't properly prepared. I can't really remember, to be honest, but like I definitely think it plays a part, but I think it's hard to say that it was like yeah.
To gain a better understanding as to how periods physically affect athletes, I caught up with Swindon Town Ladies head of physio, Abigail Simpson.
So different levels in hormones will affect athletes in lots of different ways. So recent research has shown us that rises, falls in estrogen, as well as other hormones, can have lots of different effects. One of them being muscle strength. So athletes will be stronger, weaker at different phases of their period. There's also ligament laxity. So again, in different stages of your period, your ligaments are going to be more lax, which puts you at high risk of picking up an injury, ligament injury, muscle injury, that sort of thing. You've also got a difference in like neuromuscular control at different stages of their cycle. So this is going to affect how well they can position their limbs, strike a ball, that sort of thing, and the actual control that they've got over their limbs. With less control, you've got a higher risk of injury.
So, what are some of the things that can be done to help protect athletes from period-related injuries?
I think there's a lot that we can do. First thing for me is just opening up the conversation. It's still quite a taboo topic, and I think as soon as you start opening up about that, then people are more likely to come forward with any problems they've got, and then you can counter those problems. I think better education, not just for the players, but for staff, for coaches. If you look at female football in particular, most of the staff are still males. So I think there's still some misunderstanding, which it doesn't come from a bad place. It's just they don't know.
Just a lack of knowledge.
Yeah. So I think that's probably one of the main things that we can do. Once the athletes understand how their cycle affects their performance, I think we can then start to adapt their training, and get them doing the right things during the right phases of their cycle.
Some contraceptives reduce period side effects and stop the production of estrogen. So could this be the way forward to help minimise muscle-related injuries?
I think every woman will tell you a different perspective on contraception. Some of them, it helps them massively. So for people, we've got a couple of athletes with endometriosis, polycystic ovaries. Contraception can help athletes like that. It helps you kind of control the bleeding, and then you can manage your symptoms better. But equally, some people will tell you that contraception really doesn't help them. In terms of injury rates, it probably would help, because, like you said, it kind of regulates that rise and fall. But again, I think it is just every athlete is different.
And as head physio, what has Abby put in place at Swindon to help minimise the risk of period injuries?
Dialogue, talking about it, being open. We don't often see people kind of talking to each other about it, but if there's just one avenue, so for me, like I'm that avenue in the club, if they can come and talk to me about that, then I can help them. I can adapt their training. We can, if needs be, refer to someone else, a specialist. We've got S&C here, which are brilliant. We can put the girls doing different gym sessions. They've each got individualized gym sessions, so they can kind of pick and choose what they want to do and what they feel they can do. And at Swindon, I think there isn't a taboo around if you need time off, you take it. So if I have players that I think, do you know what, they could actually really do with a rest today or for this week, then that's it, they're resting. And there's no negative effects of that. Yeah, that's the main things I think that we're trying to put in place here.
Every athlete is different, and their period will affect them in different ways. Annie Colston opened up to me about how the time of the month affects her in and around football.
I think it affects me in different ways, sort of in the phases of my period. So sometimes I'll just be absolutely knackered, like really tired, and struggle to have the want to go to training because I'm just so tired. Other times it could be really bad cramping, bad pains, bloating as well, just all around not feeling great. So if you're not feeling great, then you don't really want to train. Sometimes you don't want to play because you know you're not really going to be at your best and where you know you can be, just because you're on your period and you have like your main focus isn't always going to be on the game or isn't going to be on training, because that's always at the back of your mind. Like, just all in all doesn't really make you feel great. So there's times where I've had to just let my coaches know, like, look, I'm on my period, I'm not feeling great, I've got cramps, they're painful, so please just bear with me. I'll try and be the best that I can be, but it's not always going to be the case. There's times I've had to miss training before in the past because of the cramps, the pain.
Tailored training sessions that take into consideration an athlete's period are becoming more and more common across the female sporting industry. Recent studies have shown that players can optimise their performance during different stages of their cycle. Is this something that Swindon players would like to see more of?
100% yes. I feel like that's really important, especially moving forwards, to make sure that our training is adapted with our cycle, because at points of the cycle you're more susceptible to injuries. So you won't be able to do 100% in the sessions. And I think people need to be more aware of where you are in your cycle, what you can and can't do, or what you might struggle at one time in the month, you'd be absolutely fine at another time. So I think it is really important that we do adapt training around the cycles, and for everybody in the month or however long their cycle is going to be at different stages. I think it's really important that we speak openly about it and make sure everybody feels comfortable in what they're doing and not feel pressured into, when they're not feeling great or they know it's the phase where they are more susceptible to injuries, to then still go 100% because they know they are at risk. So I think it should be adapted around cycle.
The dropout rate of young women in sports is alarmingly high. More than 84% of teenage girls say they lost interest in sports and fitness after they started their period, and almost 25% say they are too embarrassed to take part in physical activity when going through their menstrual cycle. Annie gave me her take on how sports clubs can try and encourage young girls to take part again.
I think one of the main things, and probably easier things that could be done, is just opening up the conversation, allowing girls and women to feel comfortable enough to have the conversation and to talk about periods and how they affect each other. Like, one person might be completely different to the other person, but it's having the conversations and opening up, because you don't know unless you talk to someone else. I think potentially encouraging younger girls, but they're on the girls' team, so they feel less conscious if they were in a boys' team and potentially coming on their period. I think having supplies around the team as well, to know that if you do come on your period and it's unexpected, then someone has supplies, so you know that you will never sort of be left with nothing to use. But yeah, I think all in all, just talking about it more openly, and even having like more high profile footballers speak about it openly.
Melina is a personal trainer and sports therapist, and I was interested to see if she had come across many period-related injuries in her field of work.
I have seen repercussions of kind of not injuries but like barriers that people are coming across because they've been on their period. So for example, fatigue or stomach cramps, and obviously that will have a follow-on effect to nutrition or into workouts, because if you're having symptoms on your menstrual cycle, headaches, dizziness, I'm not too sure, like heavy bleeding or loss of appetite or stomach cramps or nausea or being sick or even diarrhea, like all of these symptoms can come from being on your period, and that will have a follow effect in training. So not necessarily the fact that they're on their period is because they've got this injury because they're on their period, but it can obviously and definitely have a lot of effects moving forward with training and stuff like that. So I guess you are more susceptible to injury.
So is more education needed around menstrual cycles?
I definitely think there should be more advice and education around the menstrual cycle, because yes, we get sex education in school, and yes, like there's obviously TikTok and stuff like that which can educate you, online doctors and stuff like that, but I feel like females going into sport, we should be spoken about, because I myself, and Lily was as well, a gymnast, and there are a lot of things that you don't really understand that's happening, like even in terms of how your body's changing. I feel like you kind of just put it, like, you brush it over because you're like, oh, this is what comes with being a woman. When I feel like if you can understand the hormone fluctuations and the different parts like luteal phase and follicular phase and ovulation and menstruation, like if you can actually understand them and understand how that works intuitively into your day to day, and tracking symptoms and like normal symptoms and maybe like red flag symptoms, I feel like that would be really beneficial for athletes and even just the general population of females.
And what advice would you give to athletes to help prevent injury?
It kind of varies from person to person, but I feel like there is like an umbrella term or an umbrella thing that loads of female athletes can kind of adhere to and get more education on, because injuries are very dependent from person to person. But the first one would be understanding phases of energy levels during their cycle, because obviously there's a lot of influx in hormones and energy levels and bones and muscles and stuff like that. So it's just understanding which phase of your cycle you're in, and maybe it might be best to avoid some form of vigorous exercise, or for some people it doesn't actually affect them that much. But that would be my main kind of tip on that one. I would also say maintaining a balanced nutrition and being very hydrated is very important as well, because you want to make sure that you are giving your body the right nutrients to recover from injury and prevent injury happening from the first place, and just making sure that you are eating and fueling the best way to obviously reduce injury, because when you are on your period, certain individuals may be more kind of prone for injury and stuff like that. So just making sure that you are hydrating and having a nice balanced meals as well, and that is obviously dependent on your goals and what you're doing obviously in sport related stuff. So if you are like a rugby player or someone like that, just making sure that you have had obviously more calories, because you are going to be kind of being hit a bit more, so you need a bit more protein as well. The other thing that I would say is just prioritizing rest and recovery, because obviously during some phases of your cycle you will be more tired, you will release different hormones that obviously do make you more tired or more hungry, like leptin and ghrelin are hunger hormones, they are released more during your cycle, so just making sure that that is controlled as well. But just other than that, I would always say seek advice from medical professionals or coaches and stuff like that, because that will always kind of give you a clear understanding of symptoms and how to get across them from a personal preference. And obviously everyone has periods, like every female will have periods, but how you choose to approach that is dependent from person to person.
As I used to be a gymnast, I wanted to head back to my old club and see if much had changed there in terms of the attitudes around periods. Speaking to the girls, it seemed as though it was something that was only spoken about among teammates and not with coaches. Lavinia also told me about how her period has affected her when she's been competing.
During British in 2022, got my period the day before when we were going to compete, and I was really anxious just because I didn't want to leak through onto the floor. And then I think the other girls also realised that I was on my period, because I was a bit moody and just a bit off. But when we got onto the floor, I just tried my best, and then afterwards I felt really drained and like dead.
The girls did say that since filming the documentary, their periods is something they have spoken about more often.
I say yeah. I think it's come up in conversation a lot more than it used to, but we were always open about it anyways, so it hasn't changed that much. I'd say.
Are you more aware of each other's sort of like...
Yeah.
So it seems as though in the 10 years since I retired from professional sports, there has been some progress. There has been lots more research done into the physical and psychological effects a period has on female athletes. One of those being done by University of Lincoln, Nottingham Trent University and the Football Association. They followed the England Lionesses over a 4-year period. Their study found that muscle, joint, ligament and tendon injuries were unevenly distributed across the menstrual cycle, proving that hormones have a clear effect on injury risk. Technology has been developed to help athletes track their cycles, which could help prevent period-related injuries such as tearing or rupturing the ACL. The Welsh women rugby team were the first team to use cycle tracking technology at the Women's Six Nations in 2023. Competitions are making changes to their clothing rules to help reduce period anxiety, such as at Wimbledon, women no longer have to wear white undershorts. Sports clothing companies are developing their products. The England team had leak-proof technology incorporated into their Euros kit last summer, and also ditched the white shorts. And high-profile athletes are speaking more publicly in the media to help break down the stigma around periods. However, despite all this progress, periods and menstrual cycles are still a somewhat taboo topic and are yet to be normalised in sports.